Now that the Supreme Court has ruled health care reform is constitutional, today local doctors are figuring out how it affects them and ultimately you. According to the Kaiser Family Foundation, more than 500,000 Nevadans do not have health insurance right now. That's 21% of our population, which is 5% higher than the national average. News 3's Elizabeth Donatelli joins us with more on what that could mean for health care here in Las Vegas.
Well, it could mean a lot of things like more preventative care, fewer trips to the emergency room, but also longer lines at the doctor's office.
All nice and just, the man hears what he wants to hear, but disregard.
Dr. Mitchell D. Forman is classically trained on the guitar, but for the last few days, he's been studying something else.
20% of working individuals do not have health insurance in Nevada.
He says overall some good will come out of the new health care laws, but also some challenges.
Patients are going to have some difficulty finding primary care physicians who are willing to see them. They're going to have longer waits to see them, and that's going to happen nationally, not just here in Nevada.
Expect an influx of people in the system, which could mean a shortage of doctors.
We're going to have to look at how are we going to expand our primary care systems. That's been an issue that we've looked at across the country, not just in southern Nevada.
Dr. Chris Cochran, UNLV Chair of Healthcare Administration Policy, says general practitioners, pediatricians, and OBGYNs will be in most demand at first. But this could also open up the doors for more physician's assistants and registered nurses.
Is going to be greater opportunity for people to find really good paying jobs.
And once they finally get through those lines, the hope is more people will have access to preventative medicine.
Now you have opportunities to see physicians and allied health professionals, PAs and nurse practitioners for your health care. So we think that's a much better, more efficient way of taking care of patients.
So while there will be challenges, Dr. Forman isn't singing the blues.
Now, both of the folks we talked to did stress that these are just predictions because, of course, Jim, there are still a lot of unknowns.
Yeah, it's a good point. We have to take this all with a grain of salt. The unintended consequences whenever there's a big change like this, both good and bad. Elizabeth, thank you.